My name is Dr. Kerry Thibodeaux. I'm a general and vascular surgeon here at Opelousas General Health System, and I've been here in Opelousas for 25 years. Unfortunately, carotid artery disease can often occur with absolutely no symptoms whatsoever. So people who are at risk for carotid disease have to be screened with ultrasound to determine whether or not they have any blockages. If they are having symptoms, it's usually what we call a transient ischemic attack, or a TIA, often referred to as a light stroke, which could manifest itself as blurred vision, dizziness, stumbling, numbness or tingling on one side of the body. The medical treatment for blockages that occur in the carotid artery involves antiplatelet drugs like aspirin or Plavix. However, if the blockage gets too severe, for example, if it's greater than 60%, or if the patient is having symptoms, then the recommended therapy is surgical intervention, which involves exploring the carotid artery and actually physically removing the blockage to clean the artery in order to reduce the risk of stroke. Carotid artery surgery itself involves a stay in the hospital, usually 3 to 5 days. The day of surgery, the patient goes to the intensive care unit following the operation, which usually lasts anywhere from 45 minutes to an hour. They spend at least one night in the intensive care unit to watch for any complications, which can include stroke, bleeding, difficulty swallowing, and difficulty breathing. So we monitor them very closely in the first 24 hours. If all goes well, then they move to a regular room the next day, and often patients go home on day 3, sometimes a little bit longer than that. Once the patient's discharged from the hospital, there's usually a week-long period before follow-up in the office. And during that time, the patients are advised to simply take it easy at home, abstain from any heavy lifting, and then of course continue their antiplatelet therapy. And then at the follow-up visit, any sutures or staples would be removed. And then the patient usually resumes their full normal activity in 7 to 10 days.